right, we'd like to say hello and welcome to the studio some special guests. Hafade, welcome.
Hafade, welcome, John, and good morning to your listeners.
Oh, yes, would you please introduce yourself?
Yeah. Hi, good morning. My name is Rose Grino. I'm a RN, registered nurse, and also the healthcare administrator of FHP Health Center.
Welcome, welcome.
Thank you so much.
So what's going on?
I'm wearing pink,
You
John.
are, yes.
As you just mentioned, October is the Breast Cancer Awareness Month.
Uh-huh.
Yeah, get your pink on. No one fights alone. That's the reason why we're here today. Thank you so much for giving us time to talk to your listeners.
Absolutely.
And really doing an awareness, to have this campaign and awareness about talking about breast cancer.
Sure. So what is your message?
Yeah, John, I just want to do that. I know it's really sad statistic, but cancer is the second leading cause of death in Guam.
Mm-hmm.
Yeah. So, and then 1 in 8 women will develop breast cancer in their lifetime.
1 in 8.
Yes.
Wow, that's a very high number.
It's a very high number. And it's the reason why the only way for us to beat that, working together, is really start with the screening early.
Yes.
All right.
How early is early?
As early. The recommended is 40 years old. But if you have a family history, I'm going to have Dr. Graves here later on to talk more about that. Is I want these women to talk about their know about their family history. If you have a family history, you know, that we can screen you as young as 35 years old. Yeah.
So if there is any sort of history of breast cancer in your family, it's important to be screened even earlier than usual.
And the important is having that conversation with your primary care provider.
I see.
Yeah, getting to know your history and what is your risk factor into that.
Well, it seems like talking and communicating is a very important factor. You're being shy does not help you.
Yes.
So talk with your family, talk with your primary care physician, learn about yourself, and talk about your family history.
Yeah, and I know you have a big listeners group over there that's listening into their offices right now.
Yes.
The working mom, auntie, grandma, or you know, all of this. That is a working age group. It's really from us, like me. I'm in the working age group. To have that even conversation in your coffee in your offices, not even the women, but even the husband, you know, the brother, and talk about, hey, you know, we do have October is a breast cancer awareness month. What do we have at risk, and who is in our family died of cancer, or is it breast cancer? And have that conversation, and that let's be aware and do this screening, because early detection is our key to beat this cancer.
So we know that October is Cancer Awareness Month, and you're here to tell us, get screened. Talk about it with your family.
Yes.
Be open and communicate, but get yourself screened.
And they are the number one partners in this. The patient itself, because we cannot do this unless they're gonna come to us, or they're gonna be able to go and get this screening. So they are actually the women are the important part of this. We all have this partnership and collaborations, but having you come and do and obtain that services and obtain that screening is really a critical message that I would like to say to our listeners.
Well, I know that maybe people who are listening might think, I would like to get the screening done, but I have a little problem. I don't have any insurance. I don't have any money right now. It's a problem. Is there a way for people to take care of this?
Absolutely. There is. We are a proud partner with a breast cervical screening program with public health.
Yes.
We've been having that for those that are insured or either underinsured that can be participate and be qualified to go into the screening program.
So if you don't have a lot of money in your pocket and you don't have insurance, that doesn't matter. You can still get screened. You can still be given some attention.
Yes. And then later on, we'll talk to you that this is going to be a lot of outreach and also a campaign that they can participate and they can contact Rachel. Is actually one of us over here that's here in the studio to let our viewers know where they can contact and where she's going to be available in this every Saturdays. I think she's reaching out to the community.
All right, listeners, so you listen very carefully. We're giving you information today about what to do, where to go, and how to get it done. Now, welcome to the studio also, Dr. Graves.
Good morning. Thank you. And thank you, Rose, for that introduction. My name's Dr. Andrew Graves. I'm the department chair and staff radiologist at FHP. And Breast Cancer Awareness Month is about bringing awareness to the scope and the lethality of breast cancer. So Rose has already mentioned several statistics, but it's worth repeating that breast cancer is very common. It's the second most common cancer, second only to lung cancer. So next month is lung cancer awareness. So breast cancer, very common. 1 in 8 women will develop breast cancer over their lifetime.
Wow, 1 in 8.
1 in 8. So what do we do?
Exactly.
And that's where screening comes into play. What does screening look like? What does it involve? We want to educate our island about what it entails to remove any kind of barriers. So
That's a
Rose
good
was
question. People might be afraid and I don't want to do this. It's too difficult. What actually goes on?
Yeah, so we understand that there are several barriers, and we want to talk about those directly. Maybe you're busy. You have a lot of responsibilities. You're a mother. You have a family. Maybe you're a grandma. You're taking care of the little ones. Breast cancer is very common. It's serious, and screening can help you beat cancer if detected early. So even if you have a busy schedule, please come in. The vast majority of cancers at their early stages are silent. The second one is people are often afraid to come to healthcare. There's misconceptions, there's misinformation, and so it's worth walking through what that looks like. So at FHP, you would call in, ask for an appointment, request an appointment, which for a mammogram, which does not require an order from a physician, which is unique.
I know typically if you want some work done at a clinic or a specialty clinic, you need some sort of referral or an order from a doctor. That's not the case here?
Not the case.
Oh.
So call in, make your appointment. You do not need an order. And on the day of your appointment, arrive, you'll be welcomed by my front desk staff, who will introduce you to Agnes, who's our mammographer, who will orient you to what a screening mammogram involves, which is a specialized x-ray.
Yes.
And she's routinely gets positive reviews about having that tender, loving care, that ability to reduce the anxiety within the patient
wonderful.
and make the whole experience approachable. And so you'll have that special x-ray, the mammogram, where they do some light breast compression while they take the imaging. And then they send those images to me, which I interpret them and provide a report to you or your doctor. And
is this something that takes all day, or is this a simple procedure?
This is a very simple procedure. The imaging in itself is just a few minutes. Each x-ray, they'll take a series of 4 x-rays or 4 mammograms, and they're captured within a second. Yeah, so
even if you're busy, that's not really a great excuse. This won't take too much time to get screened.
Even if you're busy.
Wow.
The imaging is very quick. We have an efficient process at our clinic that's also safe with COVID precautions and screening at the front desk. And so we want to remove those barriers, what this looks like. It's not a scary process. I always make myself available to talk with patients if they want to review their mammogram or talk to me about what the next step is with regard to recommendations. If there's some special recommendations, I put it in the report.
I see. I know that you're also a busy doctor and not everyone can meet with you. Is it possible that people who are listening to this program right now, that they could find some information either on the internet or a phone call? How can they get more information?
Well, there's information on the websites, on our website, and Department of Public Health has information. But it's worth highlighting that breast cancer screening is not complicated. The American College of Radiology recommends starting breast cancer screening annually at age 40.
Every year, when a lady turns 40 years old, after that, every year go get a mammogram.
Every year thereafter.
I see.
Now, the other important part to highlight is that if you have a family history or you have significant risk factors for breast cancer, you may benefit from earlier screening, starting screening mammography before the age of 40. And that's where the partnership with the clinical team, like your primary care doctor, internal medicine, or family medicine, that during your doctor-patient encounter, they'll ask you about your risk factors and whether or not you will benefit from earlier screening. Remember, the vast majority of early breast cancer is silent. You don't feel a lump. You don't notice any symptoms in your breast. You don't have nipple discharge. And that is the moment, that's the window of opportunity to catch cancer early when it's most treatable. That's the opportunity to cure cancer, to beat cancer.
I see. So before the signs are evident is the best time. But when the signs are there, is it impossible to cure?
No. And when it's not uncommon for women to present for imaging because they find a lump. They're doing their own examinations, or they've seen their doctor and their doctor does a breast examination and they notice a lump. We will put them through a process that involves starting with the mammogram to further investigate what this is.
Yes.
And it takes them through a process of investigation, sometimes leading up to biopsy. Not all masses that you feel in your breast need to be taken through that whole process all the way to biopsy.
I see.
Some of those are benign. So that's where my expertise come into play,
Yes.
where I'm looking at and interpreting the mammograms, the ultrasounds, maybe in some cases, even breast MRI, and making recommendations on the next step. And then if necessary, I do the image-guided breast biopsies. These are biopsies, they're outpatient procedures done with ultrasound under local anesthetic for the purposes of diagnosing whether or not cancer cells are present.
Wow, this whole topic is kind of scary if you don't know, but we know that knowledge helps to solve that problem of being scary. And so we're very grateful that you guys are sharing this knowledge with us. I'm sure listeners are making notes and taking, getting good information. So it seems that screening is the first step, get it done early. And then if there is a problem, to go through the system with your clinic, and hopefully over time the problem can be resolved. Is it true that if there's no history of family breast cancer, that it probably won't happen in yourself either?
No, actually, and that's the important part about breast cancer awareness, is highlighting the fact that although family history is important, 85% of women with breast cancer have no family history.
Wow. So it could come out of nowhere.
That's why it's 1 in 8.
1 in 8.
That's the 1 in 8.
1 in 8.
So a large percentage of women will not have a family history, and breast cancer at its earliest, most curable stage is completely silent, but it can be detected through screening. And it's worth highlighting that you need a full complement of state-of-the-art equipment. At FHP, we have all brand new General Electric GE products, from our full field digital mammography to our brand new ultrasound to our 3 Tesla MRI scanner, which is the strongest MRI in clinical use.
Wow. So it sounds like all of you over at FHP have got this figured out pretty well. You got all the technology and you're ready for people to come in for help. That's wonderful.
Absolutely.
All right.
And it comes with collaboration with partners in the community, the patients, and Department of Public Health and Social Services.
Absolutely.
So for our listeners out there that are underserved, that are uninsured, that is not a barrier for you to be able to receive screening mammography as part of early breast cancer detection. And so we have the folks here from the Department of Public Health that I want to pass the mic to so they can highlight the services that they provide.
Okay, very good. So we know Rachel has been here before, and Rachel is going to be out about around town in several locations helping people to register. So Rachel, would you tell us where you're going to be?
Yeah, thank you, Doc, and thank you, John. For the record, I will be at the American Grocery from 1 to 5.
Okay.
Catch me there. And then the following day, which is October 14, I will be at the Costulus Harmon.
Okay.
From 8 to 12.
In the morning.
In the morning. And then the following week, 17 of October, I will be at Payless Jigo, 19 at Payless Deredo. The time is 8 to 12 and Jigo, and 8 to 5 at Dedido.
I see.
And then for the last 2 days that I will be having an outreach, that will be on October 25, American Grocery again at 8 to 5. And then the last day will be October 27, Costuless Harmon 1 to 5.
So at
catch me there.
all of these locations and all of these dates, people can see you and they can register their information with you. Why do they want to do that?
Because, some people, cannot go to our office.
Yes.
Transportation issue, things like that.
And
So-
I understand something's happening on the 29th.
And when they are in the shopping,
Yeah.
buying their grocery, they can see me there.
So what's happening on the
Okay, on the
29th?
29 will be a big, for the purpose of this outreaches, because we will be having a one Saturday clinic, which will be held at the FHP.
FHP.
And all those first-timer, to do their mammogram or rescreen. And not only mammogram, they can also be eligible to get their pap smear, clinical
see.
breast examination, and HPV co-testing. And I just want to mention on the Saturday, which is on the 15th, I will be, the program will be at the Jonia Municipality, at the community center. Because we will be having also the village initiative outreach, and Jonia is our first village. That will be from 10 to 2 p.m.
All right, listeners. So if you're out and about and you see Rachel, make sure you say hello and register your name, because on the 29th there will be an opportunity for you to be screened and tested. It's very important.
And the 29th to be seen and make appointment on that day. And then the last one thing, John, if you may, is the proclamation signing on the 21st at the Adelope at 9:30. And it's open to the public. I'm requesting all the survivors, caregivers, that if they can come.
And that's on the
To join
21st
us.
at 9:30 in the morning.
at the Adelope.
So
large conference.
get your pink on and come out and
Pink on.
show some support. Absolutely.
Thank you so much. And
Thank
thank you
you.
so much.
All right.
I would like to say thank you.
Is there anything else? One last comment? Yes, please.
Yeah, all right. So I just want to thanks John and your listeners. So I really challenge the women out there to please start that conversation. Be in your office and be at home and be with your friends when you're doing your, your gathering there. Please talk about breast cancer.
Thank you so much. Well, thank you all for being in the studio today. And listeners, it's very important, Cancer Awareness Month. So don't be shy and don't postpone it. Get information